Hi, everyone. Welcome to this COVID-19 coffee chat on the topic of mental health and wellness. Our conversation today is focused on what we can do on the organizational level to support our staff and providers. I'm Julie Hashida. I'm a project manager for the National Healthcare for the Homeless Council, currently based in Nashville, Tennessee. Our format for today's hour is a coffee chat. We call them coffee chats because they are informal conversations. And so we invite you to get a cup of coffee or your lunch and listen and discuss. And this is an opportunity for us all to be together as a community, which I believe is a strength that comes naturally to people who work in this field. So as we move through the hour, please feel free to share experiences, share any tips that come across your mind, challenges that you've experienced, and feel free to ask for what you need. And thank you if you're in the chat, seeing people checking in, letting us know where you're coming from. And then just hoping that you stay engaged in the conversation, knowing that this is a stressful time and maybe concentration is not at its ideal state. So just to be gentle with yourself if that's the case with you today. A couple quick disclaimers. The webinar is supported, or this coffee chat is supported by the Health Resources and Services Administration, or HRSA, which is part of the U.S. Department of Health and Human Services, or HHS. So the contents are those of the authors and do not necessarily represent the official views nor an endorsement by HRSA, HHS, or the U.S. government. And then also the contents of this conversation are not meant to substitute professional mental health treatment or advice. So if you're feeling overwhelmed or needing professional assistance, please call 1-800-273-8255 or text HOME to 741741 for free 24/7 crisis counseling. And those numbers are also posted in the announcement pod below the slide. Okay, and so for this chat, we are, for a moment, shifting the focus away from helping our clients regarding their mental health, or directly helping our clients with their mental health and wellness, toward our staff, our clinicians, the frontline workers, and other providers. Even before this pandemic, as Healthcare for the Homeless, we worked from the perspective that the leaders and administrators of our healthcare systems play a critical role in maintaining the psychological safety and emotional wellness of staff. Healthcare systems taking initiatives to become trauma, or quote unquote become a trauma-informed organization, is one effort that works to support the well-being of all members of the system, and so that includes both the providers and clients. And there's a lot that goes into functioning as a trauma-informed organization, which we will touch on today. But what it is a purposeful and practical assessment and implementation of certain principles and values. And over the last several years, we were seeing an active interest in programs functioning as a trauma-informed organization. And now, as many of you have been witness to, it becomes even more critical as the COVID-19 pandemic has put healthcare providers at higher risk to experience vicarious trauma, possibly complex traumatic stress, and subsequent mental illness. So today we are using a trauma-informed lens to help systems support their staff during this time. And during this coffee chat, we will provide a framework and I'll come back to the presenter slide, but we will provide a framework to conceptualize both wellness, and trauma during COVID-19, offer concrete examples on how systems and organizations and its leaders can better support the mental health of staff. And in addition to the information and ideas we will share, we hope that this hour might offer you a chance to take a break from the critical work that you're doing, no matter what your role is in your program. Knowing that being here with us, just signing into the room as a form of presence, is helping by contributing to the community. It's sending a message that this topic is important. And I hope you are receiving the message that in extremely trying circumstances, however it's affecting you, that you are part of a network of thousands of people doing similar work all across this country. So today I am extremely grateful that we've had such a quick response to the request for the coffee chat, and want to thank our panelists. I believe our other panelist has joined us, but today we have Ken Kraybill, who is a senior trainer at the Center for Social Innovation, and Rafael Martinez, who is a director of behavioral health at Circle the City in Phoenix, Arizona. And then my colleague, Catherine Kavanaugh, who is the consumer advocate, and she's also with the National Healthcare for the Homeless Council, but based in Baltimore, Maryland. And so for today's conversation, we will be doing a round-robin style discussion where our panelists will weigh in on a selected few trauma-informed principles and respond to your questions and comments. So we welcome your questions and stories throughout the chat. Feel free to communicate as you feel comfortable, and with a reminder that all participants or audience and panelists will be able to see your submissions. And then we'll organize these, the questions and comments as they come in by related principle, and if it doesn't fit neatly in any of those, we will hold it off until the end of the hour where we have set aside a little time for an open Q&A. And as far as logistics, the last thing is just to bring your attention to, you already have noticed probably all the resources at the bottom of your screen. You can click and highlight and download those to your computer or browse our site for upcoming events. At any point, feel free to, for technical help, feel free to call Caroline at 615-200-6165. Thank you all for checking in the chat pod. This is great. So by joining us today, you are also getting a taste of the work that the Council has been doing over the past 3 years to help programs serving people experiencing homelessness function as a trauma-informed organization. Over the past 3 years, we've hosted monthly learning collaborative meetings, identified trauma-informed principles specific to our stakeholders, designed an assessment tool, created a toolkit, and developed a change package, all in their final stages of approval from HRSA. But we are using all of these resources to frame today's conversation. Something that we talk about as leaders is that a trauma-informed organization is not a destination, but a journey. We don't get that diploma or certification of being trauma-informed and that's it. It's something that we realize we will never truly perfect. It is constant growth through assessment, reflection, and adaptation. Part of being trauma-informed is knowing that it's a growing process because we want to be gentle and easy on ourselves if we make a misstep. But we must be willing to ask for feedback, to assess and reflect, and then adapt and be willing to change for the purpose of aligning better with trauma-informed values and principles. Now, during COVID-19, this may be happening at more rapid intervals. So you implement a new strategy. Maybe it's weekly meditation, group huddles for your staff. But then you're actively soliciting feedback from participants and non-participants about how those huddles are going or how to make them more accessible or safe or trauma-informed. And then as a trauma-informed organization, we encourage you to begin where you can. as far as supporting the mental health of your staff, and take small steps or baby steps, which we will give several examples of during our time today. Another aspect of being trauma-informed is clear communication, which we practice when we define terms, just to make sure that everyone is on the same page. For this particular coffee chat, when we say support mental health, we focus on the impact of trauma in this case. And so no surprise to most, we see a lot of overlap with this pandemic and trauma experiences and trauma responses. It's important that we put words to these abstract or internal, invisible experiences. The abstract is what is the base of, is what's at the base of mental and emotional health and well-being. And although there may be physical manifestations of these internal abstract experiences, there are emotional and cognitive roots at play. And for this reason, we ask the question, how can COVID-19 be traumatic? Well, many are facing isolation, rapid changes, uncertainty, direct, life-threatening health symptoms, stress, there's a lack of trust for some folks at some points, the need for physical and mental safety, and loss and grief. Seeing this, you can easily make the connection, and trauma-informed leaders know that every person and every culture has a different way they react and respond and cope with these experiences. Because our goal is helping organizations support their staff, here's a quick overview of how we define an organization or system. And we share this because everything does not fall on one person or section of people. We all make up the systems we inhabit, whether it's to provide feedback, to be trained, or to be informed, whether it's to advocate for policy change, or to implement the feedback we receive. We all have a role to play in aligning with trauma-informed principles. And this is the last slide before we kick off the round robin and discussion, and I pass it to Catherine. But the strategies that we offer in our trauma-informed organizations change package fall into one of these areas. And here we see a lot of overlap with what's going on with the COVID-19 at our health centers. Also, we know during this time, with so much going on, a simple list to go down and check one by one is a great way to assess where you and your program are seeing a lot of success and where you could put more intention in adapting to your particular system or community. And you can determine which of these strategies would be considered a baby step for your system. But we start with developing buy-in and commitment. And you can see how your organization is committed to supporting the mental health and wellness of staff. As an administrator, or maybe you're a board member or supervisor, having buy-in is basically believing and openly stating that the wellness of staff is the rationale for decisions that you make. Leading with that commitment, knowing that this is a priority, an area of focus for your staff, can help direct some of these other strategies, which I won't go into detail, but just a couple of comments. Reviewing and implementing new policies, for example, we are seeing a lot of policy change by licensing boards to ease requirements to practice across state lines for, in my case, behavioral health. So as an administrator, how are you adapting by changing practices, but also how will you continue to create this flexibility and adaptability 2 to 3 years down the road? Every health clinic has seen adaptation in their workflow and procedures, but how can we make these changes also trauma-informed in addition to responding to the official federal guidance? Many of us have adapted our physical work environments, but are we intentionally assessing whether these new environments are trauma-informed? Also, can we better adjust communication, either by frequency or quality? Are we offering education and training or encouraging our staff to attend these coffee chats or encouraging them to attend or allowing them to in some sense. Also, as leaders, modeling these principles. An easy example that you are probably familiar with is the self-care piece. But that's just one out of many principles in the trauma-informed framework. And then, as I've mentioned about all the parts of the system, how are we providing opportunities to every role in the system to give us feedback? Are we validating and using that feedback, or are we responding defensively? And so this is where the reflection part comes into play. But I'm going to stop here and go ahead and pass it to Catherine to introduce the trauma-informed principles. We will have a poll for you all, and really just to help us get the conversation going. So thanks for your time and attention, and here's Catherine.
Thank you. Yeah, so as Julie mentioned, in order to understand if we are practicing trauma-informed policies, practices, principles, we need to be making sure that we're looking at we need to be looking at the principles underlying our practices and our procedures, are those trauma-informed. So the work at the council's our trauma-informed work at the council has been mostly supported through our learning collaborative on trauma-informed organizations, and that group developed these 8 principles that they find are the underlying values of trauma-informed work. So looking at the principles of safety, cultural sensitivity and humility, transparency, choice, trust, compassion and empathy, self-care, and strengths-based. If we practice those principles, that's really the foundation of being trauma-informed. And so to lead the rest of this conversation, we wanted to open up a poll and see, we know we can't focus on really all of these principles and delving into the ways that our organizations are demonstrating these principles, but we wanted to maybe see from you guys which of these principles you find your organization is maybe struggling with in terms of COVID. So during these times and these days, we want to see which of these aspects do you feel like we need to focus on as your organization and your community. And I will also note that this Friday, this coffee chat right now is on trauma-informed organizations. On Friday, we will be also having a coffee chat that's really focused on individual self-care. So for the rest of this conversation, we're not going to focus on self-care as a big topic. We're going to focus on 3 other principles. But if you are interested in self-care, please join us for the coffee chat this Friday. But just wanted to get a sense if you guys, which of these principles do you feel like your organization and your community is struggling with? So keep putting your thoughts in here. Give you a few more minutes. Okay, I am going to be ending the poll in just a few seconds here, so get in your last votes. Okay, so it looks like at this time a number of these issues intersect, and we'll talk about that as we get into this discussion. So we'll probably talk about a few of these, but right now it looks like areas where we see the most struggle around these are around trust, compassion and empathy, and choice. Those are 3 areas where we're struggling. So for the rest of this conversation, we're going to move into those areas of trust, choice, and compassion and empathy. So I will say we do have, for the rest of these slides, we have all this information down below. So if you want to look at the slide to see what are some of the big topics under the other principles, you're welcome to look at those. But today we're just right now going to focus on trust, choice, and then compassion and empathy. So starting out with looking at trust, we're going to bring in our panelists to this discussion. So we've got, again, Ken Kraybill from the Center for Social Innovation, Rafael Martinez, the Behavioral Health Director at Circle the City, and then Julie from the Council has been involved in our Trauma-Informed Learning Collaborative, is going to share her perspective. So when we look at trust in an organization, I want to think about how the staff is able to trust the administration, how staff is able to trust each other, and how the staff instills trust for clients. So I think there's a lot of aspects of trust when we're looking at an organization. So I wanted to just, I'm going to ask the panel some of these questions, but I also want to recognize that we've got a number of people in this room who have experiences and possible insights. If you guys have had experiences around trust or these questions, if you have any ideas or strategies, please share those in the chat box. We want to encourage a full discussion, and I recognize that you guys have plenty of knowledge. So if you have ideas about strategies to improve trust or things that your organization has done that's instilled trust in you, please feel free to share that in the chat box. But I'll open up to our panelists first. So wondering for you guys, how can an organization ensure that the information being shared is honest and realistic? And then what information can administrations be using to guide their decisions that staff can feel confident in? So I think I'll go to Ken first, just wondering how you think an organization can instill trust in their staff.
Sure. Thanks, everyone. Yeah, I think I'm actually not surprised at all that trust is rising to the top. In really uncertain times, even when it's not COVID times, we all still live with uncertainty, and we don't know what's going to come next. We don't know exactly what's going on. We need good information. And this is a time for truth-telling. And trust doesn't come about by someone saying, trust me. It comes about by showing that you are trustworthy. And so when I think about how do we be trustworthy, part of that is being vulnerable and being able to show our whole selves, our entire humanity. I remember a quote from Bishop Desmond Tutu, and he was asked, what do you do in times of distress and dismay? And he said, you show your humanity. And for me, that means being self-honest, seeing yourself for who you are, acknowledging both your strengths but also the things that aren't working properly for you. I'll just say individually for myself that my brain is not working properly these days. And so part of being trustworthy is letting people know that. And so there's a lot more to be said. So I'll just, I think, leave it there for the moment. But I think it's a time to really be clear that whatever we're sharing, it's not only factually trustworthy, but it's also interpersonally trustworthy. And I think that is so important during these times.
Thank you. Rafael, what do you want to add?
What I want to add that I want to add about the necessity of having not only the information, the presentation of what we know to be an update as to how many staff members were out sick, how many tests were done, protecting HPI, obviously, how many patients tested positive, sharing all that information and being upfront, that after that information is shared, to be open to honestly answer the questions from staff. I think at Circle the City we've done a couple of things, but I think one of the most impactful moments is our weekly phone calls with all the leaders, doing a presentation and an update, and then being open to answer any questions from any of our staff. And I think that initially that was well attended because there was a lot of anxiety and fears, but each week it's dropping off the number of people that attend because people are feeling like they got their questions answered. But we continue to offer that opportunity for people to ask, to hear, and then ask whatever question that they have regarding our situation here in Phoenix, Arizona.
Yeah, perfect. Thank you. I think this definitely relates to when we see the intersection of these principles. A lot of the transparency principle comes through in the trust, and how transparent are we being with the information that we're giving and how freely we're sharing it. And I think that might relate to kind of what information and guidance people are using to make those decisions. In your experiences, how can organizations share that information with staff? How can they make sure that staff know how decisions are being made and that staff feel comfortable with those decisions, or with that process of how decisions are made? Julie, do you want to answer?
Yeah, and I think when we think about trust, there's an overlap with transparency and sharing the information in different modalities is really a cultural piece, a cultural awareness piece, knowing that some people respond better to frequent emails, but other people that may be sort of maybe overstimulating, or maybe they can't concentrate on reading and they prefer to have small group daily huddles where you meet for 5 minutes and get those updates, as Raphael mentioned. So maybe they're more auditory in that sense, or so just being aware of different modes of communication, having infographics, maybe easier for some folks or more digestible. So I think there's a lot of overlap with the other trauma-informed principles that we can keep in mind.
Yeah, and I think that's a good note for supervisors thinking about your teams, trying to know who your team is and kind of how they best receive and interpret information and how they want to be involved, and sharing that information up the board. So as supervisors or members of a leadership team, trying to ask people what types of communication they feel comfortable with and what types of, how they are comfortable giving feedback and giving input, and just making sure that supervisor is asking those questions to allow that space for that conversation. Ken or Raphael, what do you have to add about how the administration can be transparent about how they're making these decisions to help instill trust?
I think following up. Oh, sorry, we started at the same time. Go ahead,
yeah,
Ken.
Please. No, okay, all right, thanks. No, I think when I think about those decision makings and my own experience in various organizations, you know, the more that there's a voice given by everyone involved in the decision as possible to come to that decision, that's one of the best ways to be transparent and trustworthy. If it's something that is a decision that gets made without all of that input, then I think explaining what was the rationale for the decision and what are the possible pitfalls. And it's part of this idea that just because a decision gets made doesn't mean necessarily that there's complete confidence it's the decision or the right decision. And so I think this sense of conveying decisions by saying that, you know, we tried to look at everything that we could, and this is our best guess at how to move forward here. And I think that's much more trustworthy and transparent than just putting it out there as a fiat, which I'm guessing none of you do anyway. But yeah, we all need to be in this together in terms of how decisions are getting made, and recognize that some decisions also will be less than sort of welcomed, but hard decisions as well are part of being trustworthy, and I think people get that that's also important during these times.
This is Raphael. The hard decision for that our staff was struggling with is that everybody at Circle the City, because of our population of serving primarily homeless folks, is that everybody was considered an essential employee. You know, meaning that everybody was patient-facing, as far as like the clinic staff and the front and everybody involved in providing services. And so there was not that telehealth opportunity that many people in Phoenix had, because that patient population had the resources to participate in that. And so that was a little that was an initial shock for a lot of folks thinking that they had to choose between their health and their job. But I think how we handled that was, what can we do to protect you as far as PPEs, managing how many people are in the waiting room, and taking a look at and getting people's feedback and education about what we're doing to manage that, since we are essential and since we have to be here.
Yeah, thank you guys. And I like that idea of sorry, I put myself on mute. Sharing the information with our staff and making sure that we're building trust with them. I see a question here that I think we should ask when we're talking about trust is, how are supervisors and administrators trusting staff during this time? A number of staff are working remote and off on the field, and so how can we be ensuring that supervisors are trusting their staff that are working remote or out in the field, that they're doing the right thing, that they are feeling supported, that they're taking care of themselves and taking care of others? Just with that disconnection of our team seeing each other every day, how can we build trust within a team? I'll go to Raphael first on this one.
We don't have staff working remotely right now. Perhaps 2 because of medical concerns, but everybody else is in the clinic. So the question was about how we can build trust in the people that are out of the clinic. Was that the question?
Oh, yeah. I guess I thought you guys had had part of your team off remote.
No, what my point was that Circle the City, we have to be on site because our population is not doesn't have the resources to participate in telehealth, where many of the other agencies in Phoenix are working from home. And so that was an additional stressor for our staff, knowing that their peers and other companies in Phoenix were able to work from home and be, isolated and feel a little more protected.
Yeah, and I think that's an interesting issue also with trust within a staff, thinking about some of the staff who are, for organizations where you've got some staff that are frontline that are still out there every day and some staff that are remote. Is there any tension or hostility or any grievances between the staff who are on the front line feeling like they're a little more exposed and then versus the staff who have to stay remote? So maybe I'll go, Ken or Julie, if you guys have any insights into this? For trusting remote staff?
I love this question, and I think it's a really important one because we are now presented with this opportunity to really show our cards as to whether we do believe that people can and are capable of doing the work without our being sort of surveilling them, if you will. And I would say several things. One is, and this is from the Gallup poll that, folks who have looked at what supervisees need, I think it's really important that we help people figure out what's expected of them during this work, and I'm talking about remote employees here, because the expectations are going to change, and even the content might change and the focus. I also think it's important to recognize that not everybody, nearly nobody, is working at 100% productivity, so to speak, and that we just have to accept that new reality. But we can also say that productivity takes on a different form. I'll say for myself, and I do more teaching and training, but this time of slowing down, stepping back, has allowed me the ability to dig deeper into the content of things I like to provide training on and kind of refresh and renew my thinking around certain things. And so that's not what I had been doing as much before, but it's absolutely a new opportunity to do that. And I think it's life-giving in that respect. But people need clarity, and they also have to have the materials and equipment they need to do their work. And there's more to that. But I think those are the kinds of things that if they have that, we do know that people actually, with few exceptions, operate best when they're given lots of decision latitude, when they're given lots of we believe in you and we expect you to do the right thing. And so I think this is a great time for us to really see our employees as capable and competent and strength-based and believe in them. And then if there are breaches in that, then that's absolutely opportunity to also say, I have concerns here, let's talk.
Yeah, and I think that might be a good transition to the next principle we can talk about here in choice. As part of building some of this options for trust is giving people choices and then seeing how they fulfill on those choices. Right, so that when we get to the trauma-informed principle of choice, it's that people do better when they have autonomy over their own decisions, when they are allowed to be independent, make choices, construct the life and the work that they want to for themselves. So when we're looking at choice in terms of like the COVID, we're wondering, do staff have options about how they're working? We're heard changes about some people are going only remote, some people are forced to stay home. Are staff provided any option in if they would feel comfortable remote or feel more comfortable in the field? Are they provided any options? Are you asking feedback about your staff, about what is working, about their new workflow, what's not working, getting feedback from them and making changes? Similarly, things that I've heard as some organizations are switching to telehealth, are organizations supporting providers who are new to telehealth or are providers with behavioral health. It's a different sort of model in terms of the importance of the physical, personal connection, and therapy can be difficult to achieve over telehealth, and some providers might struggle with that. And are we providing support to those types of providers? And so just wondering, what options can you give staff? So I think thinking about choices, I'll just open that up to Ken first, and just thinking, what options can organizations provide for staff during this time?
Yeah, thanks. I think there are certainly options in terms of flexible use of, their time when at home. I mean, those of you who are working from home, you might have kids, you might have other responsibilities, you might be caring for other people. I mean, it may well be that your best productive times of the day are early in the morning or late at night, and so that traditional workday is one thing where we can be flexible. I think also the flexibility extends to just being more, I think, open and even more than before about what's working for folks, as you're alluding to here in this slide, and asking people what works best for them and ensuring they have choice in that respect. One other angle I would take on this, and this comes from a meme I saw recently, that each employee, including ourselves, has a choice these days to live essentially in a fear zone where we're basically complaining and about how inconvenient everything is, and we're on edge. And we all live in that to some degree, but we can also live in a learning zone. We can make a choice to live in a learning zone where we're using this as an opportunity to learn new things, including working remotely. And then there's a growth zone where we can start making choices, I think, to really bring out the best in ourselves and live with empathy and compassion and being present to people in a way that's, I think, deeper than sometimes we often do. And I would add to that this is a prime time, too, to, I'm playing on the word of apocalypse here, which some of you know is literally means to reveal or to unveil. And this is a wonderful time, I think, to look at the unveiling of all of the incredible inequities in our systems of care, and to begin to dream and begin to imagine different ways of being come whatever the new reality looks like. I pray to God that we don't return to normal in these times. I truly think we need to be thinking of creating new normals that are much more just. So those are some of my thoughts around that question.
Yeah, thank you. Rafaela, what choices and options are you guys providing for staff, or could you provide for staff?
Right, because what options can we give staff? I think the first barrier was for people to fall into an acceptance that we're all going to come to work. We're all going to come to work, and because our population requires us to be here. And then, so what options can we give to staff? We talked about the use of PPE gear and safe practices to keep themselves as safe as possible. We talked about education and the transmission of COVID virus. We had changes in our waiting rooms so that it's not packed with people side to side. Where we could see patients, telehealth, we did, but we did it from the office instead of from home, being available for anybody who walks in because we have such a high walk-in model, and open to whatever ideas that people have, that since we have to be at work, what can we do? The other options include self-care and the education and the sharing of resources that people can do to take care of themselves, from the counseling services to the resources of mindfulness and self-care. I think our emails were set up in such a way, that we hit some bullet points for those who see bullet points, and links for those who want to delve deep and read every single thing possible. And then so we did. I think we had to get over that first option, the first barrier, and then really focus on what can't be done. Everybody, would have liked to work from home, but I think once we got over that barrier and we're able to focus on, well, what can we do? We have to be here. What can we do? And I think as leaders, what our staff saw is that we were present. Where we're in the clinics and we're talking to patients as well, and we're not hiding in our offices while our staff have to be up front.
Yeah, I think that's a good point here. I talked about earlier in our strategies, having leadership model these trauma-informed principles is really important for our staff. So seeing that everyone is kind of in the same position is really helpful for our frontline staff, and that helps to instill trust, I think, as well, going back to our previous principle. But in thinking about choice, I know we've talked a lot about the need to solicit feedback from staff on what's working and what's not, and I'm just wondering, given the different methods, some staff are remote, so a number of organizations might have stopped doing all staff meetings or have Zoom staff meetings, which is maybe a little more difficult to kind of enter the conversation or feel comfortable asking a question. So I'm just wondering kind of what are options you guys can think of how can staff be asked for feedback in this kind of new remote COVID world? What are ways that we can ask staff for their opinions on things? Julie, do you have any ideas first?
I think one practical strategy would be surveys, so easy surveys where people can feel safe to give if it's an anonymous survey, like an electronic version, to give their feedback about what's working for them and what's not working for them. And giving, during times of stress, giving folks something easy to consume as far as the questions that you're asking. Not, sometimes open-ended is the best way to get feedback, but sometimes during sort of these intense emotional times, it's best to simplify the questions. Are having a staff meeting every week, has that been helpful to you? Yes or no? And an open comment box, would you like to add anything to it? And just getting feedback that way could be a simple way to learn about how your staff, how they're experiencing work at this time.
Thank you. Ken, do you have ideas about creative ways people can ask for feedback?
Yeah, where my mind is taking me around feedback and choice is one of the things that happens during these times is our lives are really compressed, and we're also needing to have an ability to broaden our lives, and what we're missing are those hallway conversations and those so-called water fountain conversations and whatnot. One of the things, I work for C4 Innovations, and one of the things we've done is established affinity groups that are self-guided by different staff, and people have a choice of which, if any, they want to join. But these go everywhere from work-related topics to self-care to bird watching to game playing. And the reason I bring that up, because this brings in the self-care aspect, is we need to keep being human with each other, and there needs to be choices of how to do that, since we don't have the typical, for most of us at least, the face-to-face contact. So that's a little bit different than maybe the question that you asked, but I think choice can come in lots of different forms.
No, I think that's a good add-on, and I'll add to that. I'm based out of a clinic here in Baltimore, and the Baltimore Healthcare for the Homeless developed a Facebook group, so all the staff could kind of stay in touch and communicate. And so I think about creating creative ways to stay in touch, I think does help us to kind of remain those, have those relationships that help us feel comfortable communicating about our choices and giving input and giving feedback. So I think having those relationships are important to build on for all of us. Okay, so as time is going, we'll move on here to our last principle. So we're going to talk a bit here about compassion and empathy. And so I think when we're thinking about compassion and empathy, we're looking at how is the organization kind of realizing where the staff is at. I think our staff have been incredible at really just diving into this on the front lines and supporting in any way that's necessary. But I think we have to think about what that means for our staff's well-being in terms of how they're processing their own feelings about this pandemic and their space in the world, and then also trying to go out and support others. So wondering, when we're looking at the compassion empathy for how we're looking at staff, how can an organization support and normalize all sorts of reactions? I think, right, as Ken mentioned earlier, some people might be more distracted, less productive. People might need to take a step back. They might just be less engaged. People might be anxious and want to do more with that energy and just want to keep constantly busy and want to produce more. And so I think there's all sorts of reactions that people can have to this. And so wondering what you guys think are ways that organizations can normalize all of those reactions and make sure that staff feel supported if their productivity is impacted, that can be accepted and normalized, and how can an organization support any type of reaction to COVID. So I'll start with Raphael. How do you think that organizations can really practice compassion and empathy with staff's reactions to COVID?
What we're seeing here at Circle the City is the leadership being really present. I mean, more present than ever before, and that includes, taking turns walking around each of our sites and asking people as we see them how they're doing, if they need anything, and just the presence that we are there with you. And I think that has been a big impact for a lot of our staff, knowing that that we're there for them.
Yeah, absolutely. I think providing opportunities for staff to connect with each other, like we talked about, in Zoom meetings, for teams and small like yoga connections, or just in how we're presenting EAP options and making sure that people have connections to a mental health provider and therapy if they need it and any support they need. So I think, yeah, providing all of those base options are amazing.
Right. You mentioning our EAP and mental health options, that's something that that we've set out a couple of times, and one of the things that we did, one of the things that I did was I said I was going to go through the process and be, for lack of a better word, the guinea pig on how to access that service, and then after that experience, I shared my experience that how it went, and being the opportunity to talk about my stress about managing this COVID experience as a leader, as a practitioner, and offering support to anybody who wanted to manage that process. Because we know that accessing mental health services isn't just as simple as picking up the phone and saying, I want to talk to somebody. There's steps involved in that. And some people are really equipped to take, step 1 through 10 to talk to somebody, and some people are discouraged after 2 or 3 steps. And then so just really clarifying the path to that kind of help that's available to everybody here.
Yeah, I love that idea, recognizing how difficult it is for everyone to take steps. We know that often we talk to our clients about that, but like recognizing that it's the same is true for all humans. And so providing those easy steps for staff, I love that idea. Ken, do you have any reactions for how organizations can normalize reactions or support staff who are struggling?
Yeah, I really appreciate, Raphael, you're mentioning this notion of presence, and which includes asking as well as listening, and listening in the way of sticking around for the answer and that kind of thing. So it's interesting these days when we say, how are you? That means so much more than it used to mean when we would say, hey, how are you? And it was kind of a drive-by question. And now I think this presence is critically important. I would say the word compassion, as many of you know, literally means, com means with, and passion actually means suffering. And I think this is a really apt word for these times, because we are living, as was stated earlier, with this huge overlay of trauma that is on top of all the other traumas that we know people experience, including ourselves in the line of work that we do. It's also a time when people are crispy, shall I say. They're feeling overwhelmed in a lot of ways, and so at times people our bodies are telling us to be on hyper alert, and we're on edge and all of these things. And so these are things that I think it's worth taking into account. And so compassion, in my mind, being with people in solidarity with their grief, their suffering, is absolutely foundational to everything we do. And I want to just say as a caveat, the importance of being with people and being present with them in a compassionate way absolutely means not trying to fix it. And I think that's the trap we fall into. We want to make it all better, when in fact the most compelling, empathic, compassionate thing we can do is often just sit with people, not to wallow in it, but just to say, yes, this is how things are, and not to say, oh, it's all going to get better, or make false promises, or to say, this too shall pass. I mean, I get the rationale for that, but that's discounting to the actual experience people are having. And so in the same way you don't go up to people and say, I feel compassion for you, or I'm feeling empathy for you, we show it. And it's an action. These are action terms in which we embody this sense of being with people in solidarity. And then all the other conversations from there can flow. But without that, I think we're missing the mark.
Yeah, I think COVID has definitely taught us that it's time to sit with the discomfort, and we've got to get comfortable doing it. Julie, anything you wanted to add?
No, I had posted something in the chat responding to Antonio. So he had mentioned about when we were talking about choice, about asking our staff about their needs, maybe family needs, or their experiences at home if you are working remotely, or even basic needs during this time. And then also because it's showing compassion, that it's not just the bottom line. And we all know this in healthcare for the homeless. We don't come from that maybe mindset of many of us. We're kind of working from the heart in a sense. So we do have that compassion that comes naturally to us, but being intentional about asking staff about their personal lives and being okay with them not sharing if they don't feel comfortable, but showing that I care by asking, and then having some resource, practical resource on hand to respond if they're saying, well, we're concerned about insurance or benefits or things, and saying, oh, well, I have a person that can respond to those questions, or I have an information sheet I can give you, or going back to vulnerability, being able to say, I don't have that right now, but that is something I can, I will look for some resources for you. And then, just that vulnerability piece. And then I think I will also add, going back to the strategies about leaders modeling. And this can also overlap with self-care, but the self-compassion piece and being gentle with ourselves, not feeling, I guess I'm also reiterating what Ken mentioned about feeling like we have to solve all of our staff's problems, but just being more compassionate with ourselves about how much we can do, and then, getting help ourselves when we're feeling overwhelmed or in that case. But those are just a couple of maybe random thoughts with that.
Yeah, no, I think that's perfect to kind of lead into my last question here, as we're acknowledging that our staff do have a number of needs during this coronavirus time, whether they are acting as caregivers for people who are sick, or taking care of their children who are staying at home, or struggling with their own personal mental health and just don't have the same brain capacity or emotional capacity to deal with the emotional labor of supporting people. Are any organizations thinking about how adapting or shifting staff roles or responsibilities? I'm just wondering if staff have a specific need with changing their hours or their type of work just for this time. I'm wondering from you guys, do you have any experience in your organizations about adapting any roles or responsibilities to help support what staff's needs are or their limitations in this environment?
We've worked with a couple of staff that have childcare needs, and fortunately we have a respite program that's open 24 hours. So we were able to make some shifts to be able to have some staff do their hours at the respite program.
Nice. And I don't know, Julie or Ken, if you have any ideas about how organizations could consider shifting their roles or responsibilities?
The only thing I'll add is that we know that employees are most satisfied when they're doing work that they feel like they're good at or they have competency in. And I think this COVID time has caused some types of work, at least in my organization, to fall away. But it's also allowed us to shift some people's work hours, some of the work hours, towards doing new projects or doing things that they always kind of wanted to be involved in but hadn't been before. So it's kind of a time of expanding potentially for people into realms that either they want to test their interest or they are very interested in and just didn't have the chance before. So I'm not sure how that plays out in various organizations, but again, opportunities, I think, for people to grow and develop even in the midst of this time.
Yeah, absolutely. And I think this goes back to what you were saying earlier. There's a lot of challenges that COVID is unveiling in terms of our systemic inequalities and things that we can change. And so I think taking this time as an opportunity to look systemically as a country, healthcare system, and as an organization about how we can be better approaching our work in this world in trauma-informed ways. I think it's just an underlying trying to stay encouraged and motivated during this time. There's a lot of negativity around the coronavirus, and so I think as much as we can, trying to frame it as an opportunity to learn and grow and live in the world, create the world that we want to live in. And so I will pass it up to Julie to wrap us up.
Yes, so we appreciate all of you joining today's coffee chat. If you have any questions on this topic or anything else you'd like to share, our email addresses are on this slide. Again, we have a self-care, a dedicated coffee chat to self-care this Friday, so please join us for that. And at this time, we'll say goodbye, and we hope to see you again soon. So stay safe and be well, and thanks again, everyone.